If you're suffering with back or neck pain, or even numbness in your arms or legs, the Southeastern Spine Institute has created a new medical show to help address some of your worries and concerns. At our new state-of-the-art medical center, we practice comprehensive patient safety and use the latest medical technology and spine treatments to help you get out of pain and back to your active life.
A very, very unique situation, and one that doesn't exist in too many places in the country.
I think it's exceptional because everything's there. They have their MRIs, they have their x-rays, the doctors are right there, everybody's working together.
Being in our new building, it's been a great advantage in that all of us are here together under the same roof.
What was great about it is that I was able to call over to Southeastern Spine without going through a family doctor or somebody else to go ahead and make an appointment to be seen.
And that's one of the advantages of seeing all of these doctors in different specialties that treat all areas of the spine.
I knew without a doubt that everything they had set up to do, that I was going to come out of this just fine.
We pride ourselves on getting patients in quickly when they're in pain, and it's important to get that addressed quickly so it doesn't become permanent nerve damage.
So easy to come down, call, and there's no appointment needed, and I said, can't nothing be that easy, not getting to a doctor.
Patients who present to Southeastern Spine with back pain, arm pain, leg pain, often don't need surgery, and that's why we're here.
I am so grateful that it's in our area where we have the availability to it.
Hi, I'm Vanessa Hill.
And I'm Angie Mazzell. Welcome to another edition of the Southeastern Spine Institute's Medical Show on Spine Health.
We are here at Southeastern Spine's brand new state-of-the-art medical center. Now, for the over 80% of you watching right now who may experience back or neck pain in your lifetime, things just got better.
That's right. At the Southeastern Spine Institute, they practice all of the latest COVID-19 safety precautions, and they only treat spine patients. So you can get the help you need for your back or neck pain without the added exposure of going to the hospital.
Patient safety, coupled with the latest technologies, medical treatments, and a wide array of board-certified physicians, has helped thousands of patients get rid of their back or neck pain for good.
So stay tuned to learn how this larger, modern medical facility helps keep the Southeastern Spine Institute and you always one step ahead.
Now that we've been able to have a bigger space where there's more operating rooms, it really does help to increase the quality and efficiency of care that patients can have.
From my standpoint, that's very gratifying because I'm going to be able to help more and more people.
All under one roof and always one step ahead. The Southeastern Spine Institute proudly presents another edition of The Age of Spinal Medicine. This medical documentary explores the latest in modern medicine and gives you an inside tour of our state-of-the-art spine facility, conveniently located in Mount Pleasant, South Carolina. Once again, your hosts, Vanessa Hill and Angie Mazzell.
Welcome back. The Southeastern Spine Institute is now bigger and better than ever. Throughout the show, we'll take you around and give you a first-hand look at the new facility.
That's right. And since the first step to take in getting the proper treatment for your specific back or neck pain means getting the best diagnosis, we start at the expanded MRI suite. Here, patients can get right in to see exactly what the problem is. And our first story starts with an athletic woman, Aline Khan, who simply picked up her dog Zoe to help her get into the car, but Zoe jumped wildly in her arms and Aline heard a pop in her back. At first, Aline thought she was okay, but later that night, everything changed.
Went in the walk-in closet that night to take off my jeans. I went to pull those down, and when I leaned over to pull them down, the most excruciating pain hit me. I had to crawl out, and this leg was not moving. This leg was dead. I had nothing here, no feeling whatsoever. I couldn't pick up my foot.
The first thing the next morning, Aline went to her neighborhood chiropractor, whom she had known for years.
He said, I can't do anything. He said, my best recommendation at this moment is Southeastern Spine Institute.
At the Southeastern Spine Institute, they get patients in as quickly as possible because they know when you're in pain and suffering muscle weakness or numbing, it's very important to get evaluated as soon as possible before things might get worse.
We do pride ourselves in getting patients in as quick as possible, getting them expedited, being seen, evaluated, getting the appropriate imaging done in an expedited manner, and coming up with a plan based on that imaging.
And a part of coming up with a plan is getting accurate imaging from Southeastern Spine's new state-of-the-art MRI. Angie has more.
With new wide-bore MRI, Southeastern Spine can now provide more patient comfort and precise diagnostics for your specific issue. These modern MRIs allow the patient to go into the unit feet first, helping those who might feel claustrophobic. And with the latest technology in reading and evaluating the imaging, doctors can have a more accurate diagnosis when they sit down with the patient to create the best medical plan for fixing their specific problem.
He had already had the MRI, the X-ray, and the information. And when he walked in the room, basically all that I remember, because I was so uncomfortable, was, you have to have surgery, and the sooner the better.
And those patients that are having numbness and tingling, weakness, that oftentimes is related to pressure on the nerves, and that needs to be addressed so that they do not end up with permanent nerve damage.
While the vast majority of Southeastern Spine's patients never need surgery and can be treated non-surgically, in Aline's case, surgery was the best course of action to get her back into her active life, and she couldn't have been in better hands.
In terms of a surgical reason to come to Southeastern Spine, we have the ability to do everything in a way where you have multiple providers all working together in the operating room.
There are many hands helping out in the operating room to help expedite the care and make it safer for the patients.
I was just so grateful that he said, I can fix this and you're going to be fine.
For many active people, when they hurt themselves and are in extreme pain, they fear that they'll never return to their same active lifestyle. But with the advanced technologies and procedures found at the Southeastern Spine Institute, their patients are often finding that they are getting back quicker than ever.
So I think now the way we do things, we do minimally invasive procedures, smaller incisions.
And in many cases after surgery, they're able to be much more active and return to a lifestyle that they really enjoy.
To be able to go from where I was a year ago today, I know that I couldn't have done that without his help and expertise.
Often these modern surgeries allow people to get back to doing the same things that they were doing before they started having back and leg problems. And in Aline's case, she was able to get back to training for the Cooper River Bridge Run. Although the pandemic canceled the 2020 Bridge Run, Aline ran a virtual bridge run and continues her love for running and is now back to her active life. An important part of any recovery is to have trust in your doctor, who can give the comfort and confidence when you are going through a trying time in your life.
There's some kind of spirit that comes with Dr. Bryan that gives you that patient comfort that he's in total control with you. I felt at ease with that.
You know, Vanessa, it's interesting that when Aline's doctor realized that he couldn't help her, he immediately recommended that she go to the Southeastern Spine Institute.
Well, we've said it so many times. You don't need a referral to set up an appointment at Southeastern Spine. So if you're experiencing back, neck, or even leg pain, don't wait. You can call directly and set up your own appointment.
Okay, and what would be the reason for your visit?
Speaking of not waiting in pain, in our next story, you'll meet a man who, after a car accident left him in extreme pain and a buzzing down his arm, he knew right away who to call.
I started feeling some buzzing inside my fingers, and I knew that's not normal and that shouldn't be something that's put off. So I called Southeastern Spine to get an appointment to come in and see him.
Call the Southeastern Spine Institute now at 866-SPINE-50. No doctor referral is needed to make an appointment, and online virtual exams may be available.
Our next story is about professional athlete Ray Smith, a Taekwondo grandmaster. Ray has had a long, successful career, including being an 18-time state champion, a U.S. national champion, plus winning gold medals in Pan Am Games and U.S. Open Olympic team trials. Although no longer competing at an Olympic level, Ray has over 40 years of teaching the next generation of Taekwondo fighters, winning National Coach of the Year 3 times. But then one horrible day, Ray was hit by another driver in a car accident. And afterwards, he was in such pain that his personal and professional life came to a sudden stop.
I just was in agony, sitting, standing. I just was in constant pain day and night. You can't function like that.
As you know, when you're in pain, you just want to know what's wrong. And Ray had to find out. So he went straight to the Southeastern Spine Institute for a state-of-the-art MRI and a spine expert evaluation.
Doing just fine. Hang in there.
He pulled those MRI results up right in front of me on the computer inside the room, and he said, this is what's going on. There was a rupture in the disc. I could see physically, right in front of me what was wrong. Well, my biggest fear was being handicapped. And he said, you're not doing what you normally do now, so you are handicapped.
Over 90% of Southeastern spine patients do not need surgery. But if you, like Ray, do need a surgery to correct a structural problem in the spine, rest assured the Southeastern Spine Institute has the latest medical technologies found anywhere in the country. And so often after a surgery to unpinch a nerve, patients find immediate relief.
It went great. When I woke up from anesthesia, I knew my fingers were moving. I had no pain anymore. It was gone.
These modern surgeries have shorter recovery times, better outcomes, and may be done at Southeastern Spine's own in-house surgery center. It's another reason the Southeastern Spine Institute moved to their new facility. Now they can help more people who need minimally invasive surgery, doing so without their patients having to check into a hospital. Here they're in a safer environment and most often can go home the same day. The new ambulatory surgery center has also been expanded with more same-day surgery and outpatient procedure rooms to help you get out of pain faster.
The main advantage of the modern surgical center is that it allows us to do these modern, minimally invasive surgeries and send the patient home right away.
They can have most surgeries done in a setting outside of the hospital. It really does help to increase the quality and efficiency of care that patients can have.
I'm cured. I'm cured because of Dr. Paletti and Southeastern Spine.
And under the same roof as his MRI and surgery, Ray was able to recover using specialized spine exercises and Southeastern Spine's improved physical therapy. While past his Olympic-level competition days, Ray wanted to get back to his active life.
I still run, I still kick, I have full functioning life.
We caught up with Ray and some other patients at the new Southeastern Spine facility, and we asked them about the team concept with everything under one roof.
I've been a big fan of being able to get all of the things that you need in one place. That's really important, that you can come in here, you can make your own referral, you can come here, they see you, they don't put you off for weeks and weeks.
That helps a patient a lot because they feel better, they feel loved, they feel confident. They're not scared of what they might have to go through because the doctors and everybody, the whole team, just make them feel wonderful about everything that they're doing here.
The assistants right on up to the secretaries, the insurance people, everybody is here and they're all working together to help you get better and get back into your life.
There are so many new and wonderful technologies available now. So if you don't want to check into the hospital, the Southeastern Spine Institute may be just the solution you've been looking for.
Right, Angie, and when we come back, we'll see how the new ASC and those new technologies have helped so many people, even those right here at Southeastern Spine.
And I was like, no, I want to have it done with my people, my anesthesia, and you here.
If you've been told or think you might need back or neck surgery, you don't have to travel far. The Southeastern Spine Institute uses the latest surgical procedures found anywhere in the country for simpler operations and quicker recovery times. And since the Southeastern Spine Institute is in your own backyard, you know they'll be right there with you each step of the way, helping you get back to your active life. So call 866-SPINE50 today and make your own appointment. Virtual exams may be available.
We return to the ASC for a remarkable story about a Southeastern Spine nurse who works in the ASC but had a not so unique but quite innovative procedure, the cervical artificial disc replacement. Neurosurgeon Dr. Thomas Anderson explains.
We always consider artificial disc replacement because we like to try to replace the broken part of the body with something that is as natural as possible.
Our story begins a month earlier when the ASC's own Tammy Dyler was helping her husband by holding the ladder as he cleared leaves from the gutter after a 3-day rain.
As he leans, of course, the ground gives and the ladder starts like this towards the concrete. Well, in my panic mode, I grab the ladder and snatch it back. The minute I did, I had a pain, like an electrical shock, shoot down the arm and down in between my shoulder blades.
Well, Tammy actually works with us, and she works down here in our ambulatory surgery center. She came to me and said that she was having some difficulty with her neck, and she had a ruptured disc in her neck, which is the cushions between the bones in her neck, and the ruptured disc was pinching a nerve, causing her arm pain.
My arm progressively is getting more numb with like a bear trap onto my elbow. And this is going on 24/7.
No matter what your specific pain issue is, the medical professionals at the Southeastern Spine Institute always try to address each patient from a non-surgical or a conservative approach, all under the same roof. There are many options for the over 90% of patients who do not need surgery.
Majority of patients really don't need surgery for multiple different reasons.
We always try to avoid surgery if we possibly can, and so Tammy went through a course of conservative treatment, but unfortunately she wasn't improved by that, and we had to talk about surgery.
Although no one wants to have surgery, in Tammy's case, she not only felt comfortable with that option, but comfortable where her procedure was going to be performed, in the Southeastern Spine's in-house ASC, where you can be treated as an outpatient with no overnight stay or a need to check into a hospital.
I'm comfortable here. I'm confident here. I've seen what we do.
So Tammy came in, did her operation. It went very, very smoothly, and we watched her closely afterwards in our recovery area, and then she was able to go home that same day.
By the time I got here that Wednesday, my arm was totally numb and useless. All I could do was do this. I couldn't reach, grab, or anything. When I woke up from the surgery, it all worked.
Patients feel comfortable when they come into the Southeastern Spine Ambulatory Surgery Center. Not only are they getting the latest technologies and medical procedures, but they know that safety is a main priority. And Tammy would know. She is board certified in infection prevention and control and is in charge of making all patients safe, even in the age of COVID-19.
I feel like we are really ahead of the game. I'm able to talk with a lot of other ASCs, and they're asking us how we do what we do.
Remember, the Southeastern Spine Institute is not just for back and leg pain. They perform many same-day cervical or neck surgeries in their new ASC. And the advanced technology of the cervical artificial disc is just another way that Southeastern Spine is staying one step ahead.
At Southeastern Spine, we're always looking for the best technology, and artificial disc replacement in the cervical spine certainly is the latest technology.
This next story is for those of you who are lucky enough to have found something you just love doing, because you know that if constant nagging pain prevents you from pursuing that passion, it can be very sad and frustrating.
We all hope and pray that we can live a long time and be able to do things. If you ever get to a point where you can't, how tough that would be.
If you've been told or think you might need back or neck surgery, you don't have to travel far. The Southeastern Spine Institute uses the latest surgical procedures found anywhere in the country for simpler operations and quicker recovery times. And since the Southeastern Spine Institute is in your own backyard, you know they'll be right there with you each step of the way, helping you get back to your active life.
Call the Southeastern Spine Institute now at 866-SPINE-50. No doctor referral is needed to make an appointment, and online virtual exams may be available. Once again, your host, Angie Mazzell.
People look for their passion in life, something that truly fulfills them. But when back or neck pain prevents them from doing what they love, they can feel dejected. Our next story is about a successful artist, Lynn Bennett. When back and leg pain got so bad for her that she couldn't simply sit or stand for very long to paint or create her art, it was a sad time.
I couldn't stand up for a few minutes to paint. Even if I was sitting and had an easel in front of me, I couldn't do that very long at all. And so that was That was sad.
Lynn likes to encourage others. She says she likes to remain positive in life. So when she sees a problem, she says it's time to fix it.
Yes, I would encourage them 100%. Let's get motivated. Let's get up. Let's do what we need to do. Go see the right people.
Lynn had heard the right people were the team of doctors specializing in spine care found at the Southeastern Spine Institute. So she called and made her own appointment and got right in to see Dr. Richard Frisch.
Miss Bennett had pain in her back and pain traveling down her leg. So we first wanted to figure out what was going on. So we got x-rays and then subsequently an MRI. About this particular space.
I had bone-on-bone L4 and 5. That was why I couldn't sleep. I couldn't lay down. I couldn't ride in a car. Could not go up and down steps.
Since over 90% of Southeastern spine patients can get out of pain without ever facing surgery, giving people as many best options as possible was another reason for their move to the new facility. And now there's a much larger area for physical therapy, which means even more patients will be able to get out of pain and back to their active lives without surgery.
They're super supportive, but mostly they listen and they just encourage me. There was a time when I couldn't even lay on my stomach, and now I'm doing push-ups.
We know it in and out. We've dealt with plenty of spine patients, of course, and so we have a better feel of how to treat the spine.
After trying a number of non-operative procedures, including physical therapy and epidural shots, Lynn was still experiencing so much pain, she was told she might have to take pain medications for the rest of her life, or have a minimally invasive corrective surgery that might help alleviate her problem once and for all.
When he told me that I'd have to be on medication the rest of my life, I knew I didn't want that. And they pretty well knew exactly what they could do, get me back up on my feet again.
We have doctors of many different specialties, all working under one roof. We think that we have the spine problems covered from A to Z, and we do think that there's something to offer patients that have been told that there's nothing that can be done, that there's no hope.
I had heard from many other people that this was a wonderful group of doctors, many success stories, and so I just felt very confident about it.
Utilizing the latest medical technologies found anywhere in the country, a team at the Southeastern Spine Institute performs minimally invasive surgeries where the surgeon comes in from the side of the patient. While avoiding cutting any muscle, skilled surgeons make an incision less than an inch long. A small tube is inserted and tiny instruments are used to correct any problems in the spine. After her recovery from her successful surgery, we went out to visit Lynn and her family in Camden, South Carolina to see if she got back to her passion. We found that she was not only able to sit and paint again, but also able to get back to her active outdoor country life. Lynn had to travel from out of town to get to Southeastern Spine, but she said it was well worth the trip because you know if you're hurting, you'll go almost anywhere to find relief.
Well, no matter where you live, and your neck and back are constantly hurting and you haven't been able to find any relief, it is nice to know that there's an amazing place that you can go to, get the help you need for fast relief, and it's all under one roof.
Patients often travel to see us from far-flung places in South Carolina, and we want to give them the best experience possible.
When you're in pain, the last thing you want to do is call a doctor's office and say, all right, you can have an appointment a month from now. We really try to gear things here to have enough physicians around who can see people quickly and hopefully get them feeling better quickly as well.
And she said, sir, do you want to come down tomorrow? And I said, tomorrow? I was really floored. I just couldn't believe what was taking place. I said, ma'am, I have to make arrangements. I didn't know I could come that quick.
David Abrams from the Columbia area had a severe case of spinal stenosis. That's a narrowing of the spinal canal, which makes it very difficult to walk any distance. It's a problem that many people out there might be able to relate. Perhaps you've seen people walking in a store, leaning over the shopping cart to help relieve the pain.
My husband, David, would walk a short distance and he would bend over in excruciating pain, and then he would stand up and then he'd walk another short distance. It was very hurtful because I couldn't do anything to help him.
David's wife, Vina, knew it was up to David to make the decision of considering surgery after having tried so many other things.
And so when he finally discovered that he needed to do something differently, I was delighted that he was going to do something for himself.
When David and Vina got to the Southeastern Spine Institute, they discovered the answer that so many other people had found, a wonderful place with everything under one roof.
When we got there and we saw so many people, I'm thinking to myself, this must be the answer. It wouldn't be so many people here.
David was able to quickly get an MRI and a professional evaluation of his problem. At Southeastern Spine, they have seen this condition many times before, so they were able to give him the best options to help him get out of his chronic pain.
It's the aging degenerative process, stenosis. So everybody that comes in here at some point will have an element of stenosis. It's just who's affected. And that's usually immediate pain upon standing and walking within 5 minutes.
After talking with PA Amanda Harridge, David sat down with spinal surgeon Stephen Paletti, who explained that the minimally invasive surgery that worked for so many stenosis patients before might help him get out of his pain once and for all.
And he said, from that, I think I can help you. But the biggest relief was when he was telling us it wouldn't be such a major invasive cutting or surgery.
And we have the ability to do minimally invasive neurosurgery, where with an endoscopic approach, we can unpinch a nerve through less than a 1-inch incision.
Vina was so happy for David that he made the decision to have the modern surgery because he now felt so much better and he was able to get back to work in his favorite shoe shop.
And when he made that decision, oh, I was so delighted for him because I knew he would feel better.
The part of it is I went in pain and came out pain-free.
For so many people, the Southeastern Spine Institute has been a real lifesaver.
Well, that's it for today. We hope you enjoyed the show.
And now you know at Southeastern Spine's state-of-the-art medical center, you don't have to suffer with back or neck pain anymore.
And remember, you don't need a doctor's referral, so you can make your own appointment and your own choice. Plus, Southeastern Spine now offers online virtual medical exams.
And as always, we'll leave you with some of the thoughts of real patients who were so happy that they found the Southeastern Spine Institute.
And be sure to join us next time. Just maybe we'll tell your story.
Bye-bye.
I was hurting too much to go from one place to another. So I like this idea of the one stop.
If you're sitting in pain with back pain, neck pain, you shouldn't be doing that. You need to call up Southeastern Spine, make yourself an appointment, and change your life.
Talked to a bunch of people who'd been here who got their life back. And it was very important that I quickly got my life back.
I feel like we give excellent care. I feel like the physicians are excellent at what they do. And it's a real team effort. We all are invested in this to get that patient to where they want to be.
I'm thinking to myself, this must be the answer. It wouldn't be so many people here. If this place was not doing something for people, they wouldn't be coming here.
Thank you for watching. To learn more about advancements in spine medicine, visit southeasternspine.com. You can also see any of our other Age of Spinal Medicine episodes by going to southeasternspine.com/streaming. And to make your own appointment, please call 866-SPINE50. No doctor referral is needed, and online virtual exams may be available.